Yeah, there you go.
Felt that.
Yeah, okay, so you felt it. Now that might have been shocking at first, but did you find it painful at all?
No, I'm still here.
Yeah, that's important. Don't want a second one suddenly leaving in the same day. That's a joke, guys. Nobody does that. Ooh, that's a really big one.
Oh. 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 Is it rolling?
Yeah, you can swear. That's fine.
Oh.
It's okay. We bleep those
God.
out. Coming down.
Yeah.
Scott,
Hi.
good to meet you today.
Good to
Thanks
meet
for coming
you.
in.
Thank you.
So Scott was referred in by a friend of mine, and he's been dealing with a variety of different kind of aches and pains throughout his, I guess it'd be your job and just kind of your life in general.
Yes.
Do you mind kind of sharing with those what those are before we get into it?
Yeah, I don't mind at all. So a lot of my physical, I would say pain, is in my upper shoulders and in the back of my shoulders. Upper back, middle back, and lower back. So a lot of back stuff. I feel like because I am taller, I do carry around a tremendous amount of weight. And there was a lot of pressure. I've been feeling some form of pain in my knees too. But maybe that's just a strengthening issue. I don't know. And then some of my glutes. I think that those areas definitely need strengthening. And I am on my feet a lot in my daily life, my daily work. Yeah.
Okay, so the shoulders, I'm trying to get a sense of like a timeline here. So the shoulders, how long have those been bothering you for? The knees, hips, how long have those been bothering you for? Like, start with the shoulders.
Yeah, of course. So I've had shoulder problems for I think about 2 years now.
Okay, so that's a while. But so what do you remember something that onset it? Like, was there trauma, or did it really creep up out of nowhere?
I think it slowly creeped up out of nowhere. Again, it's the right shoulder. So this shoulder has been through a lot through jobs. When I was a server, I only used this side.
Got it.
Right? So I think over time, it slowly came to this point. And yeah. And then for the knees, I think since I've been taking fitness very seriously, over the course of a year and a half, I felt a little bit more pain in the knees. I can't do like lower squats and hold them as much.
Where in the knees do you feel that discomfort, and is it usually on your squat-like movements that you're feeling that discomfort?
Interesting. So it is mainly on my squat-like movements without weight, even without weight. Here.
Okay, so you're feeling kind of on both sides.
Yes.
Then, so he pointed to kind of, if you can see my fingers, on the inside as well as the outside aspects.
Yes, this specific area right here.
Fair. And that's regardless of weight, right? So would it get worse if you do load it up, or do you find it actually gets better if you load it up?
This is gonna sound weird, but to your point, it actually is better when I have weight. I don't know how that works.
Yeah.
I don't know why.
That's okay. I do. So that's not uncommon.
Interesting.
The good news with that is that if you are experiencing a knee pain that actually gets better as you load up more weight, it's very unlikely to be a tendinopathy complaint, which is or a meniscal or knee issue itself. It's more likely to be related to your available range of motion. Why? Because when you load up more weight, that forces the hips and ankles to move through heavier ranges of motion, which actually takes pressure off the knee. But I'll get more into detail with that for you later. We've talked about that a few times on this channel. But okay, so let's do a hip exam before I get carried away with that. It also ties into why your glutes might be particularly sore.
Please, yeah.
Okay, so tell us about the upper back and the lower back then too.
Yes, so my upper back specifically, I think I would benefit from more rows. And it's really about getting the form correct. I've been corrected on my form, and I'm trying to implement that more. A lot of it is upper, and a lot of it's lower, because I argue that a lot of my lower back pain is unfortunately from improper form. And I am tall, right? And that does have its own caveats.
That does create some difficulties with certain weighted movements around barbells specifically, so yes.
Again, when I bend down, it like my whole, there's so much force going down when I bend down, so my center of gravity, if I'm saying that term correct, if I'm using that term correctly,
you are,
is, I guess, off.
Why? It's more, usually when you're taller, it's because you have longer femurs. When you do have longer femurs, anytime you're doing that hip hinge movement, which is present on squats, which is present on deadlifts, which is present on bent over rows, you're putting a higher load on your low back just because you're pushing your hips further back, and of course your low back then needs to move further forward. So people like you are predisposed to developing that kind of discomfort. It's not, it could be because your form is wrong. Okay, I haven't seen your form. I can take a look at it later if we like. But it all could also just be your normal biomechanics.
Yeah.
Now that being said, tall people weightlift all the time. Okay, so there's easy. I'm not going to say the word easy actually, but there are ways to work around that and still get the workouts in that you're trying to get. Okay. Okay, so we've talked about the lower back, the upper back, the shoulders kind of, or the right shoulder specifically. That's been bothering you for about 2 years. Where in the shoulder do you get that pain? Is it on the front or is it more on the back aspect?
Oh, God.
He's poking more to the upper and back aspect around the upper trap, so we'll screen the shoulder anyways.
I'm going to say this area.
Okay, yeah, so he's looking at the trap and more the pectoral, which is less shoulder and more shoulder girdle, the muscles that are attaching onto it, which is a good thing. It's easier to treat that than it is the shoulder proper. We'll screen the hips, we'll screen the knees, and I think we'd be able to help you out today. Any other concerns at all, or is that pretty much summarized?
No, that's
perfect.
That's it. Yeah.
Okay, so what we're going to do is we're going to get into the physical exam now. Okay. And we're going to confirm with an eye everything I just said, and then we're going to get into the treatment component. Sound good?
That sounds great.
Awesome. So Scott was saying that it's his right shoulder that's bothering him more. That's really good from a filming perspective because that's where the camera is, and this is his right shoulder. So, what's this? I noticed you have a tattoo. What's it of? It looks like a nice cottage landscape. It's somewhere I'd want to go.
Oh, thank you. Yeah, no, that's my dog, and that's my feet, and that's us walking into the Sunset Adventures together.
Oh,
he's no longer with us.
It's same thing with my dog, man. I get it.
But I guess just to kind of stay on topic here for a second, this has nothing to do with the pain.
Yeah, no. I just saw it and I was like,
thank you, though.
That probably has meaning because anytime there's a sunset, it's meaningful.
Lot of meaning.
All right, let's screen the shoulder itself for the rotator cuff muscle.
Okay.
So I'm going to get you to start by giving me a thumbs up like this. Just keep your arm there. Don't let me move it, okay? Fight me. Does that cause any shoulder pain for you or not particularly? Nope. Give me a thumbs down. Is this better, worse, or the same as just before?
A little bit worse. Just a tad.
Just a smidgen. Okay. I'm going to come over here. I'm going to bend the elbow and wrench you kind of like that. Is that okay? Ooh, what do you feel?
A little bit of a sensation, but nothing like overbearing.
Where exactly? Can you point to it?
May you do that one more time?
Of course. Perfect. Okay, so kind of right where we'd expect it. Okay, you can drop that. So that's a Hawkins-Kennedy test. It's screening for the available area of the supraspinatus muscle. I'll walk you through this anatomy afterwards, but Sarah, I'll get you to throw a picture of the supraspinatus up there so that they can see exactly what I'm seeing. If we're getting pain on that, it's possible we might have some impingement going on. It could be just due to poor shoulder kinematics. It's not moving correctly, which is also possible if we're having a tremendous amount of tension up here in the trap. It doesn't want to let it slide as much. I'm just hypothesizing right now. We don't know anything for certain yet. I'm going to bring this up. I'm going to rotate your shoulder. I want you to push your hand into my hand as hard as you can. Is that causing discomfort for the shoulder?
A little bit of discomfort.
Where?
That is correct. Now it's
more through the deltoid region, the whole shoulder itself. Okay, push your shoulder back. Push your hand back towards my hand. Is that okay?
That's actually better.
That's better. Okay.
That's better.
Put your hand behind your back.
Palm, okay.
Yep, perfect. And I want you to try to lift your hand off and try to touch the wall back here. Does that create any pain for your shoulder there at all?
Not a tremendous amount of pain, just like, I guess, a little bit of, if I can use the word, resistance.
Got it.
Yeah.
Okay.
But not pain.
Bring your hands back to neutral. Good. I want you to lift both arms. I'll come forward so you can see what I'm talking about here. I want you to lift both arms up to your side as high as they'll go. Let me get behind you first just so I can move the shoulder blades here. Go ahead, do that. Yeah, as high as they'll go. Keep going all the way up towards your head. Okay, shoulder blade is going. So we're not seeing any winged scap, so serratus anteriors are doing their job. You can drop those down. That's good. All right, so let's do a thoracic range of motion exam. Now I'm going to get you to give yourself a tight hug, really tight hug. You probably earned it. Now I'm going to get you to rotate as far as you can to the left side. Okay, as far as you can, and that's as far as we can go. Okay, we've got pretty good thoracic range of motion here. We've got 80 degrees. Let's rotate the other way as far as we can, Okay, again, pretty good. We've got 80 degrees. So if you've got stiffness up here, it's not showing. Well done. Okay, so I don't. Did you say you were doing yoga or something along those lines?
I do a lot of. Thank you. I do a lot of vinyasa yoga. and hatha yoga and Pilates.
I've heard of the hatha yoga. I'm not sure what the other one
It's
is.
a gentle and slow.
Okay.
The vinyasa flows a little bit faster, but
Got
but we're talking a big range of motions.
Yeah.
Like
Mhm.
arms are always coming up, the
Mhm.
breath is going through. So
It's very obvious that you're doing something for mobility because most people cannot hit 80 degrees bilaterally on the thoracic rotation.
Oh, okay.
So, well done. You're
Thank-
taking good
okay.
care of yourself. Keep it up.
I will.
Now, tension-wise or pain-wise, like I think you were pointing to up here beforehand with the shoulder. Is that
Yeah,
correct?
yeah. That's where I feel
That
pain.
right
Sorry
there?
to interrupt. Yes.
No, you're not interrupting. I'm looking for that. And then what about if we compare that to right here instead? Which is worse? 1 or 2? This is 2.
Can you go
This
back
is
to
1, so we're looking at the upper trap.
Oh yeah. Oh yes.
And this is 2, we're looking at the left scap, which is worse.
Yeah,
Upper
no,
trap,
1.
Definitely
1.
the upper trap.
That one.
there,
Yeah.
huh?
Ooh.
Okay. So that's a little bit tender. You know what, while we're in this position, I'm going to get you to tilt your right ear to your right shoulder for me. Tilt. I'm going to take an elbow. I'm going to put it right there. And I'm going to get you to slowly bring your left ear over to your left shoulder, okay? As a disclaimer, this might be a little soreness inducing. But
So bring this
ear to that shoulder there, okay?
Okay.
Go ahead. Can't see his face from here, but I can see it on the screen over there. Tilt right to right, come back.
Okay.
Come right back. You can come right back. And now slowly to the left ear to left shoulder. Scott's probably thinking, oh, it's not too late to run away.
Ooh.
Yeah, I don't have to be here for this.
Interesting.
Yeah, that's a big knot that you got there. That's a really big knot in the upper traps that we're trying to take care of a little prematurely. Here, usually I wait till towards the end of the videos to do this, but it's quite tight, so I want to get right on it. You're going to tilt your right to right,
Okay.
left to left. We're going to do this 3 more times, okay? Good, yeah, breathe with it. That's smart. Just right to right, left to left. Good. Awesome. And right to right, left to left.
Ooh.
You feel that up into your scalp?
I do.
Yeah. Mhm. It's a very engaged upper trap muscle. It's definitely something we're going to want to take a look at, okay?
Okay.
Good stuff.
Okay.
All right.
Ooh.
Nice. So we've screened the upper back. We've screened the shoulder. Got a little bit of impingement going on here. We've got definitely some upper tension of the traps. We're going to try to release that, see if that helps the shoulder move better to take the impingement off the supraspinatus there. That's going to be my game plan for it.
Okay.
I'll walk you through that too to make sure you actually understand it.
Yeah,
Okay,
yeah.
remind me once the video is done though. So as Scott was saying, he's getting some bilateral, meaning both-sided knee pain with his unweighted squats. Okay, when he's feeling that pain, he's feeling it on both sides of his knee, both the medial or inside and the lateral or outside aspect. Is one knee worse than the other, or are they both pretty similar?
Pretty similar.
Pretty similar? Okay. He's also saying that he's got bilateral glute, what was it, tightness, pains? What's going on there?
Tightness.
Tightness, okay. So we know that the glutes are one of our primary hip movers, extenders, okay? They also help to externally rotate the hips. The knee is the messenger or the communicator between the hip joint, I'll use this side so you can see the hip joint, and the ankle joint, okay? So as an example of this, the knee doesn't actually initiate any movements itself aside from very mild external rotation. To illustrate this, I challenge you to try to move your knee without moving your hip or your ankle. You can't. Okay, again, except for that very small external range of motion. So if there's an issue with the hip in terms of achieving its full range of motion, or if there's an issue with the ankle in terms of achieving its full range of motion, guess who has to absorb all the created shearing force? The knee. And that's why the knee pain coming up first is usually actually the first thing we see in either a hip or ankle range of motion complaint or impingement complaint. Anyways, I'm getting ahead of myself here. I should actually probably screen him first. So let's bring this up. Bend the knee, and I'm going to get you to just relax as best you can. Okay? I'm going to rotate in like that, and we can get to about 15 degrees, which if I'm being totally honest, is a lot less than I was expecting in somebody who can get 80 degrees of thoracic rotation. Okay? So I know he's already mobile. I know he works on it, but that's really reduced. That's okay? Yeah, so that's external rotation. External rotation, he can get to the full 90. That's a lot more common. People are much more able to externally rotate than they're able to internally rotate. Let's check the other side. I'm gonna bring this up. Relax here. I'm gonna rotate. Okay, so we're noticing a significant range of motion difference. So we see here we can get the internal rotation to, actually you can't really see it very well on this, but we're at an easy like 50 degrees. Okay, why is it that we can get 50 degrees here, but 15 degrees on the other side? And here, That's a little bit tighter on the external rotation, but not by much. So what I would want to do is I would definitely want to find ways to open up this left hip to see if that at minimum takes away the stress on his left knee. Let's go ahead and check out the feet down here for a second. You okay if I take your shoes off?
I don't mind.
Perfect. All right, I'm going to take your shoes off there. Awesome. So taking your feet, chill right there. I'm going to lift both feet up into dorsiflexion. And it looks like his right ankle doesn't like to dorsiflex as much as his left one does, okay? To test that, I'm putting my hands on my, what they're called, quads. Wow, okay, you can tell it's Friday. And then leaning into it, okay? Giving my full weight so that it's equal on both sides. This ankle much more readily flexes up towards the rest of the body. This ankle is reduced by maybe about 15 degrees. So if I had to guess, my educated opinion is the reason you're getting knee pain is due to an internal range of motion reduction on the left hip and a dorsiflexion range of motion reduction on the right ankle. So if we correct those two things and then you go do some bodyweight squats, I think the pain would be decreased. Okay? That's my impression. We'll test that all out in the gym after we're done filming it here, okay? All right, so Scott was saying that he gets quite a bit of tension in his low back as well as his upper back. Upper back might be related to the shoulder, the neck, and the upper back are all very intimately connected biomechanically, so if you get an issue with one, it's likely you'll start to develop issues with the other. Lower back, similar with the hips and the quads as well, our hip flexors pretty much. So let's go ahead and feel through. So, do you get more stiffness or pain on one side of the low back, or is it pretty symmetrical? Like, where do you feel this?
I would say symmetrical.
Symmetrical, okay. Is it lower down, kind of near the sacral area, or the bottom of the spine, or is it kind of higher up, more in our paraspinal or muscle region?
Interesting. Can I say that it is both?
You absolutely can say that it's both. No problem there. All right. Yeah, you just breathe normally, okay? Just feeling through right now. So how do we feel in through these? Yeah, okay, so we're tender in through the rhomboids of the left shoulder. I mean, those are pretty common. I wasn't necessarily expecting them because, again, most issues are on the right shoulder. But let's go ahead and take a look over here and compare them. That's tender in through there a little bit.
Yeah, but not as much as the left.
Not as much as the left. Okay, so now you have or have not been adjusted or quote-unquote cracked before?
Nope, I have not been cracked.
Okay, well, this will be fun. The first time you adjust someone, there's no way to know how much force they actually need in order for them to release. Okay, like I've had 300-pound bodybuilders on this table who I could basically sneeze on and everything would release. About 100-pound ballerinas on the table who I need to, like, quite literally body slam to get things to go.
God.
So with you, obviously, we're going to start light. Okay, and if it doesn't go, then we're going to add more force. Gradually, of course, gradually. Any kind of questions about that at all? Or?
Yes, I definitely have a question.
Go ahead.
This is a dumb question.
No, there's no such thing. Well, actually, I take that back. There are definitely such things as dumb questions.
Okay,
but go
fair.
ahead. Take the risk.
I will take the risk.
Yeah.
The stupid question of the day. Will I know that it cracks?
Depends.
Okay.
Depends. Sometimes it's very obvious. You'll hear a loud sound or like that cracking that people are familiar with.
Okay.
Other times it's less obvious. It'll be much more muted. You won't hear the sound, but there will be a shift that you or I will feel. There have been times where I've adjusted people and like, oh, I don't think that went. And the patient's like, are you kidding me? That felt great. It was like, okay, if you felt it, then I'll take your word for it. So it's really every body, literally the body, adjusts differently. Okay, and there's no way for me to tell you that preemptively because there's no kind of predisposing factors for me to gauge regarding that.
Interesting. So there is, because obviously you were trained, I didn't want to cross a boundary,
of course.
but there is a possibility that you might not feel it.
Of course there is, yeah.
Okay.
So that isn't all the time. I gotta say, but like most of the time I can tell. But there have definitely been times where somebody's just so locked up and so stiff, and we get movement in there. But to me, I'm not sold. I'm not sure on it.
Interesting.
So then I'll do it again. And
Okay.
if there's nothing again, but the patient goes, no, that definitely moved, I'm going to take their word for it. Because if they felt the movements, they wouldn't lie to me about that, right? They obviously want it to go. So
Okay.
yeah. Oh, look, as soon as that was a little release right there. That wasn't even intentional. I think the microphone got that. That's me, you guys, not you. That you didn't get an email. That was me. So let's go ahead.
Yeah, I felt that.
Actually, give this a try. Yeah. So I mean, with you'll probably be like the majority of people where it's obvious. So let's go ahead and I'll get you to take a big breath in for me, and then all the way out, please. All the way out. Good. Keep it all out. Yeah, there you go.
Felt that.
Yeah. Okay. So. You felt it. Just breathe normally for me now, okay? Good job. Now that might have been shocking at first, but did you find it painful at all?
No, I'm still here.
Yeah, that's important. Yeah. Don't want a second one suddenly leaving in the same day. Yeah. That's a joke, guys. Nobody does that. Relax. All right. I'm going to do this side now, but to do that I have to be in this position. Is my butt in the way? No, it's not. So I'm going to kind of do right here. To do that, I do need to just turn your head. It's not a neck adjustment though, okay?
Okay.
Right in through here. Good. That's a little bit more stubborn.
Yeah, I didn't feel that.
Yeah.
I felt it, but I didn't
But you
feel
didn't
it.
feel it.
Yeah.
I gotcha. Okay, breath in. All the way out. Fast, all the way out. Ooh, that's a really big one.
Oh. Oh.
Good job, man. That was begging for it. Damn.
I think I heard that.
Yeah, you did. I think they heard that next door. Okay.
Oh my god.
Damn, dude. Well done.
What do you mean I was asking for that?
Like your back. Oh, there's
Oh.
another good one. Your back released so well that it was actually way easier than I was anticipating it to be. So, good news. That went phenomenally. Breathe. You did great. Your first time with a chiro upper back has gone very, very smoothly.
Great. That's
Uh.
awesome.
Yeah, don't worry. We'll get to the scraping and massage stuff later. You'll like that, I'm sure. Okay.
I don't know if I like the word scraping.
I'll walk you through it. You'll love
Okay,
it. It's a
good.
sports massage. It's a sports massage.
I see.
You adjust somebody. I'm going to get you in position as I explain this, okay? You're going to take this, I'm going to pull here, I'm going to take this, I'm going to place there. So when you adjust somebody, what you're doing is you are restoring the range of motion to whatever segment you're adjusting, okay? So like we adjust joint structures. Scooch the hips towards me, please. Good. So we can do that to the spine, of course, which is what chiropractors are traditionally known for. We can do that to pretty much any joint in your body, okay? Now, when we do open up the joints and we restore full range of motion, the spine can now, well, whatever we were using, so that's why I'm debating doing it to your ankle too, can now move through its fully available range of motion. But things just like stress and usual day-to-day activity can cause these things to lock up to a degree. Now, you still have very good mobility in your upper back, but my belief is, especially now, we'd be able to bend better forward as well as backward too. So the fact that it released very easily tells me that, hey, the body probably wanted it to happen. Okay? So, for the low back, I'm going to position you just like so. I'm going to get you to just try to relax your upper back as much as possible, okay? I'm going to come in here, place my hand right about here, and roll you towards me. I promise you're not going to fall off.
Oh! Oh! Is it rolling?
Yeah, you can swear. That's fine.
Oh!
It's okay. We bleep
God.
those out.
Oh!
Take a second, buddy.
Cheese. Cheese.
Breathe,
Cheese.
breathe.
Goat cheese.
In through the nose, out through the mouth. Good job. In through the nose, out through the mouth. Good job. How you feel? Coming down? Coming down?
Yeah.
Bad news. We gotta do that one more time, okay? We'll get you on the other side whenever you're ready.
Okay.
Take your time.
Okay. It's good that you were distracting me
Oh, that's what I try to do, man.
with knowledge.
Bad news is that I have to do that twice, and that's hard to do.
Wait, yeah, on this side, right?
No, the joke is that I can only distract somebody
Oh,
one
okay,
time,
fair,
right?
fair.
So now you kind of know what's coming.
I do.
But let's put you right there. We're gonna bring this leg up. We're gonna scooch your hips closer towards me, please. Good stuff. Lay that shoulder back, good, and breathe out for me. Good job. All the way out. Nice. Good. Ooh, you okay?
Yeah.
Okay. You try one more time. There we go. We got it that time. Good job, buddy. Breathe for me. You can lay on your back if you like, if you're more comfortable there. Watch the mic right there. You're good. You're good.
Jesus.
I like this new strategy of leaving the camera rolling.
I think. So, okay. So, obviously, the left side, when I was facing this way, that was much louder of a noise.
There was a lot more to go there.
What do you mean by that?
Like we had a much larger release again on the left side as compared to the right.
Okay.
My guess is that, again, anytime we have a reduction in the range of motion of a joint, the areas above and below overcompensate. Okay?
Yes.
So again, with this left side, we already know we're getting a huge reduction in the internal range of motion of this hip, and we're also experiencing knee pain, which is the joint underneath the hip. It makes sense that the the left side of the lower back would be more locked up.
Yes.
Okay? So that's the thinking there. And it checks out so far.
Okay. Yeah, don't scrape my back off.
No, I will not scrape your back off, but I will scrape some of the fascia. So like I explained to Scott just now, we are going to be working on the fascial component of his lower and upper back. Yes, sorry, this stuff is usually a little bit cool.
Yeah, I'm ticklish.
Okay. Yeah.
Not really, but like that tickled.
Okay, so what we're going to do is we're going to start spreading it around and we'll get into our usual sports massage stuff. He's aware of the petechiae that may form. That's the name of that redness that I showed you beforehand. So at this point in time, I usually like to ask my patients a question, give the audience a chance to connect with them and them a chance to connect with the audience, vice versa. And today's question is going to be a classic one that we do quite often. To tell us something about yourself for which you are proud of, but don't get to talk about very often because it sounds like you would be bragging.
I would argue that I am proud.
You don't have to argue about it. You're allowed to be proud about it.
See, there you go. There you go. They're already catching me. I am proud of the experience that I've had in the marketing world. And sorry, it's hard to do this.
That's okay. That's okay.
Experience I've had in the marketing world that I am very calm when challenges arise.
Okay, can we ask what you mean by experiences in the marketing world? Talk about your job a little bit for context,
Of course.
or no? Yeah.
The majority of my work right now is I work as a brand ambassador, which is essentially a hype person for a brand.
That seems like a fitting role for you, truthfully.
Thank you. It requires a lot of energy to do this job. And I have repped brands such as, not God.
God's a brand now?
Yeah. But, oh, goodness.
That's tight right there.
That's, okay, this is hard to do, but I shall do it.
I know. Half of the reason I ask is a distraction to you. So.
I'm not that distracted.
Well,
so.
darn, I need to ask better questions.
No, it's not you. It's what you're doing to my back.
So kind of me.
It'd be different if you were asking me these questions as like a butterfly was landing on my shoulder compared to that.
Compared to the crowbar here.
Compared to this, yes. Oh,
we are getting, so right in this spot, I know that you're very tender on this spot, but we're starting to get that petechiae formation right here.
Really?
Okay. Yeah, coincidentally, perhaps.
Interesting. Let's just focus on that, I guess.
So brands such as.
Oh, okay. You know what?
We're gonna go. If you can't talk, that's fine. You can just try to suffer through it. If you must.
I'm gonna suffer through this.
Okay.
I'm just gonna let the audience
live in suspense.
Yeah. What brands does he mean? Well, you don't get to know.
Sorry, guys. I'm ruining it for you. Oh, look at that. It feels amazing, guys.
Is it not supposed to?
No, I mean, yes it is, but your reactions led me to believe that maybe you weren't enjoying it as much as the average patient does.
No, I mean, who walks around and gets their back scraped by a crowbar?
Crazy people, or my entire patient base, one or the other,
So I'm gonna go with no.
I love you guys. That's not an insult. I like all you patients.
I'm gonna go with no one walks around and has that happen.
Not particularly. No,
So,
not super common.
Obviously, it's a sensation that's different, and if I have knots, like maybe that one.
Yep. Oh, there's some more right there. Yeah.
That's great.
I know. We're on a treasure hunt.
Jesus. Different sensation. Oh my god. So you said there was going to be like a massage portion of this?
We'll get to it, I promise.
Yeah, it doesn't feel like we're going to get to it.
Oh, we will.
Jesus. Is that a knot?
Yes. You have several up here in your rhomboids there. Remember when we were feeling through, especially on this this left side for whatever reason, we had a lot of knots and lockups through the rhomboids, and this is exactly where our rhomboids are. Sarah, you can throw a picture up kind of over there of them. So I'll just go ahead and work through that region as well. We did manage to get an adjustment in through there, but still we want to address the muscular component as well. We are holistic creatures. Very rare is it only ever a muscle knot. Is it only ever a joint lockup? Is it only ever a fascial restriction? It's usually all of the above in some form of combination, which is why we like to hit it with all the different things.
Great.
Yes.
That all sounds great.
I hope so. Probably not to you right now, but it's what you're going to be suffering through.
I definitely retained all of that.
That's okay, man.
I'm even writing notes down here.
Good. Pass you a little pad and paper.
Yeah.
Pad, paper, pen. Yeah.
Yeah, I would drop it.
Mm-hmm. Please don't. Well, I mean, I'm not passing, so drop whatever you like. Good. Yeah, we got lots of petechiae actually through both sides up here.
Let's stay on message. What could that be a result of?
The petechia? Oh, okay, yeah, sure. So, as I explained to you beforehand, as I explained many times on this channel, petechia, this kind of redness, it's technically a microbleed. Okay, some other chiropractors, practitioners on YouTube, for whatever reason, will say, "Oh, look at all the toxins we're releasing from the body." I don't know why they say that, because it's not a toxin. It's literally a microbleed. We know what it is. Okay, so what it is in this case is that fascia, being a superficial structure, doesn't respond well to traditional massage, yet it can adhese up, it can restrict up the same way any kind of muscle can in your body. So instead of doing deep tissue massage, which just penetrates right through it, it's much more responsive to doing instrument-assisted soft tissue therapy, or gua sha, which is exactly what I'm doing here. Now when we do release a present fascial adhesion, we get this petechiae, we get this microbleed. It's a totally normal response with our understanding of the physiology that's occurring. So what we've noticed is that if we are to continuously do this on a semi-regular basis, the fascia eventually heals correctly. It no longer adheses up, and we get all the benefits we get as if we were relaxing our muscles. It's an entirely different system though, so the two can compound. Relaxed muscles and relaxed fascia equals happy, healthy body. There you go. We're gonna work our way down now. I'm excited for you to watch the video back of this.
I'm just trying to blow a candle out.
You're doing great. Happy birthday to someone. Happy birthday to someone.
Yeah, let's just stay in the moment. Oh.
Speaking of the moment, this channel just turned 2 years old, so happy birthday to the channel, and thank you to everybody watching. Don't forget to like, comment, and subscribe. Thank you so much for your support.
Yeah, you should all do it. Yeah, that's great. Okay.
I think you suffered enough.
I think so.
We're going to switch over to the actual fist stuff now.
What is that? Oh, your fist.
Yes.
Oh. It's okay that my toes are wiggling.
That's totally okay.
Great. 'Cause
whatever you need to get through. If you want a stress ball, I can give you a stress ball. Like,
no, I would kill it.
Good, because it's my stress ball. I need it.
Yeah, because it would die. Oh. I didn't spit. No, don't worry.
You go ahead, do whatever you need to. I clean this table after every patient.
I'm sure.
Okay.
Oh!
Right there,
Oh. Sorry, you have to watch this, Sarah.
It's okay. She's used to it. She'll actually find you super interesting. She's a super artsy person, so you seem quite like you were a drama kid, now you're a drama adult, so.
What up, Sarah? Is she a drama kid?
Well, she likes the arts. She appreciates the arts. She's more of a behind-the-scenes type person. That's why she's my editor.
I've worked behind the scenes as well. As you can tell, I'm very behind the scenes. Oh my god! You know what? God, we'll have to do this later, Sarah.
Yes. That's a knot. Yeah.
What is that?
Oh, your rhomboids or my thumbs?
Is that a knot?
Yes.
Dear God.
It's either a knot or a joint restriction lockup. The rib heads are right at this level. We have our spine, obviously. Just about an inch off to the side is where our ribs or our costals connect into the vertebrae themselves. So this would be our costovertebral joints, which could be a little locked up for you, but... We're almost finished, okay?
Does my back have those things on it?
The redness, yes.
Is it?
More so from here to here. You got not too much down here, but there is some.
I'd like to see what it looks like.
You will see afterwards.
Oh.
Good job, man. Alright, I'm gonna clean you up now, okay?
What, oh, is there blood?
No, like I'm just cleaning up the extra
okay.
gel. No. So it is a microbleed, but it's not actually bleeding on the surface of your skin. It's within the skin in the same layer for which we get tattoos, actually.
Yes.
Yeah.
Yes.
Mm-hmm.
Yes. My tattoo on my right shoulder. That was quite a process.
Yeah, probably. It was difficult for you?
It was my first tattoo.
Mm-hmm.
It's quite a big tattoo.
It's large. It's a big one.
The tattoo artist I did it with was amazing. Quick shout out, Jay. Love the guy.
Good job, Jay.
Him and I were very transparent. If I needed to stop and just breathe.
Well, I'd hope that a guy jabbing you with a needle would be sympathetic towards your need for a break. So
He was.
Good.
He was fantastic.
All right. Massage gun coming in for you, okay?
Yeah, that felt great.
Happy to hear it.
Especially like going at the glutes.
Do you want a little bit more on the glutes?
Sure.
I'll give you some more. Why not? You've been such a good sport. You've explored so many new things today.
I have.
Good reward. So we're going to try to mix in a ankle adjustment for the right ankle here. As we recall, on testing the dorsiflexion aspect, that's bringing the toes up towards the rest of the body, we were reduced on this side as compared to the left side. The left side had the hip reduction, whereas the right side did not. We've got pain on both knees, so where's it coming from? So it's my belief that this could use some work. So the way that we're going to do that is there's like 6 different ways to adjust an ankle. I personally like to literally, quite literally, just give it a pull like that. But the way that we do this is, I'm actually going to get you, Scott, to hold on to the table for me with your hands there.
What?
Yeah, exactly. Because in order to create enough of an impulse through here, if you're not gripping onto it, I'll just pull you off the table. And it doesn't hurt, but it just doesn't go anywhere, right? So you can hold the head or you can hold the sides there, perfect.
Here, hold on, let me,
yeah, there you go. And I'm going to shut up now and we're going to see if we can get anything out of this. So, there we go. That's it right there. You okay?
God.
Good job, man. All right. Happy to hear that.
Did you wait? I think my noise may have interrupted. Did you pick up the?
Oh, it's good. Don't you worry.
I felt
You'll feel that all the way up the chain.
like, what was it? Like, I thought I heard a noise of something, like when you did that.
Yeah, no, there was a
internally.
noise. Yeah.
Okay.
There absolutely was. That was the cavitation, which is the same as the cracking of the spine, except it was within our ankle mortise, right? Which is
Okay.
exactly what we were going for, okay? You did great, dude. Scott, how did you find... I think I know how you found it, but how did you find all of that?
So I definitely felt a tremendous amount of sensations that I have never felt before.
I think that's a...
Which is, I'm saying that in a good way. I'm saying that in a good way.
Good.
My body, I feel lighter.
Mm.
I'll say that.
Mm.
I'll just go through some sensations
Go
that I
ahead.
have right now. Like, things definitely feel tremendously more loose, right? And I feel like I have gained a little bit more mobility. I feel that there's like a release of certain parts of my body, and it is like these are positive feelings. I feel happy. I feel relieved. But I'm so curious as to how this is going to affect me in my day to day. If I go work out, which I am planning on working out today, how that's going to affect the movements. I feel like there's weight lifted off, if that makes any sense.
That's a very common sensation described,
Okay.
especially if somebody's never had this done before.
Oh, okay. Yeah.
Because when we do have those tensions and adhesions kind of build up, we don't perceive it as weight or as tension because we're just kind of used to it. Our body's really good at hiding stuff or overlying pains right up until it's not, and then we have a problem. But that's a very common is I feel so much lighter afterwards. Very, very common.
I definitely feel lighter, and I feel like one big thing that I'm really feeling right now is, how do I say this? More specificity as to where I need more work done.
That's a good one.
I definitely can. The parts of my body are highlighted where this area. This is where you have a lot of tension. This is where you have a knot. Like I definitely feel them like protruding now, and I'm like, okay, this is clear.
You're more aware of them.
More aware of them, right? And the fact of, I didn't know. I had a feeling that I was stronger on one side of my leg compared to the other. When we do in the classes that I take, one leg balances, I'm able to balance way more on the other. And now coming here, working with you is kind of like, oh, this is maybe why, right? This is as much as I can say right now. That's throughout the day. I feel like I'll explore more of sensations.
That's honestly a great answer, truthfully. We didn't record this on video and we are running out of time. We got patients coming right at 1. We got about 5 minutes left here. But we did screen the left hip after we had done the treatments, and we found that we were able to get it up to 45. I do want to show him how to further internally mobilize that hip to get it to open up, ideally so that you're even on both sides, 55 abouts. And I think that would help to relieve that knee specifically. I'm hoping that this knee would feel quite a bit different, but I would also want to show you mobilization for dorsiflexion of that ankle too, right? And because I don't think we're going to have time, I'll send you videos instead, just that you do have. When I do that for my patients, if there isn't enough time for rehab, we will definitely make sure that you have the tools needed in order to promote your own health in that aspect. As far as working out after this goes, go for it. It's actually healthy from a joint point of view to work out following getting adjusted. It's usually or just after the first session that I recommend. You usually don't push any PRs. Why? Because your body essentially just got shocked. Okay, so for that reason, you don't want to put any more unusual amounts of stresses until we know how you react. Once we do, man, go nuts. Go get that deadlift PR or whatever it is. Okay?
I think today...
just take her easy.
I'm going to do my... Well, I'm working out legs and shoulders, but I'm going to just have a nice workout.
Awesome.
Where I don't
Happy to hear that.
And die.
Please don't do that. That would be very unfortunate for this to be your parting memory to the world.
Well, I mean, hey, you know what? If it is, I went out in a blaze of comfort.
A blaze of fascial adhesion. Okay,
that's that.
Jesus. Okay. Thank you so much for coming in. Do you have any other questions at all for now, or are we good until next time?
I don't. I'm just excited in the next little bit if I need to do more work, because I really enjoyed a lot of the sensations. But
all right. Well, I'm here when you need me. Thank you so much for coming in.
Thank you, Doc.
Take care.
Don't forget to like, comment, share, and subscribe.
Thank you so much, Scott.